Hello, good morning, and welcome to Clinic Affairs. It is me, your host, Dr. Pressy, on Clinic Affairs today. Oh, I'm not sure I'm live or not. Good morning, good afternoon. Where you're watching me from? Welcome to Clinic Affairs. It is me, your host, on Clinic Affairs, Dr. Pressy or Dr. Precious. Today, and how are you doing? Are my friends and all the people that love Clinic Affairs, where are you guys? Come. And my number is displayed up there. If you need to call me, you need to ask me questions. So today I am going to be starting on the big topic, and then I have question on headache and asthma, and also menopause. I will answer that after, but today I have come for us to look at the big topic I put out there: acute myocardial infarction. So, and we call it, in a simple man terms, we call it heart attack. So that's what we are going to be considering today. So we're going to be looking at what it is and how we can diagnose it, and what preventive measures can be put in place so to prevent you getting into heart attack. So the first thing we're going to start now is, what is myocardial infarction? So myocardial infarction is normally known as what we call heart attack. So in a simple term, it's called heart attack. So, but what does that mean? So it means necrosis of your heart tissue. Necrosis means death of your heart tissue. So that's, God, this hair is disturbing me. Sorry about that. So it means necrosis of your heart tissue. So when I say myocardial infarction, it means that the tissue in the heart is dying, and why is it dying is as a result of what we call occlusion. Occlusion means there's something that is blocking an artery in your heart, and by the time the artery is blocked, blood cannot flow through it, and then there's what we call dead tissues start building up in your artery, and we call them plaques. We call them what we call arteriosclerosis, which is fat deposit. So fat can come from the food we eat. So those fat deposits can form in your in someone's artery, and the artery that is mostly affected is what we call the coronary artery. So the coronary artery is the one that is mostly affected, and is the heart, is the blood vessel that supplies the heart. So occlusion, I want you to know that occlusion is when there is fat plaques, or sometimes it could be blood clots as well, or sometimes it could be that the arteries are overstimulating, and then it causes like a breakage in the arterial wall of the coronary artery. And or occlusion could just be, mostly is what we call atheroma, which is fat deposit in the artery. So when that happens, it can lead to what we call heart attack. I'm going to explain a little bit more for you to understand what I am talking about. So an artery is where it carries blood to your heart, and then also carries oxygen. So when blood flows, it has what we call hemoglobin that binds oxygen and it takes it to your heart. So when someone have an occlusion, it means that in that artery that supplies your heart, the coronary artery, there's a particular blockage in that artery, and I've said that it could be fat deposit, and also it could be blood clot, or sometimes it could be maybe stress induced that will stimulate your arteries, and then the arteries start, excessive contraction, and you now have the artery torn, where we start tearing, what we call aortic dissection. The artery start tearing from the inside and then causing some chemical response as if there is an infection. So neutrophils, white blood cells, they just rush there when the artery is torn in aortic dissection, and they start to build up at that point. So when this occlusion is built up in your artery, it means that blood cannot flow through it. And a lot of you have seen so many videos about coronary artery. You have had so many explanations, but I'm explaining it in simple African English and anybody can understand me, that it's occlusion that causes coronary artery disease. So now, when that occlusion happens, so remember I told you that occlusion leads to necrosis of the tissue, meaning death of that particular blood vessel. So when that occlusion happens, right, so it will cause decrease in oxygen supply to the heart. When the occlusion happens, that means that there's not enough blood that is flowing through that blood vessel, the coronary artery, to your heart. And then the tissue of the heart will gradually be deficient of oxygen, and when the tissues are deficient of oxygen, there's what we call low perfusion, and that this low perfusion will lead to the death of the tissue or necrosis. So that is one thing you have to know, how that happened. And then what happens is that once the tissue start dying, there's what we call cardiomyocyte, which means the cells that are produced in the muscular layer of the heart. So when that tissue is dead, the cells now will be released, and when that cell is released into the blood, that there is a problem in the artery of the heart. And what immediately happens is that there will be signal, and like I said, now the white blood cells will start to try to feed on that area of the artery that is being blocked. So, and when that happens, oxygen is not flowing through there again, and that particular side of the artery is dying off. So what now happens is that when the membranes of this heart, the membrane of this artery, start leaking into your blood, when we do a blood test, because there's a destruction of the myocyte, cardiomyocyte means the muscles that line the heart, the cells within the muscle of the heart. The heart had three coats. We have the pericardium, is the outer layer that covers the heart, and then we have the myocardium, which is the second layer, which is the muscular layer where blood vessels are best, and then we have the endocardium, which is the inner part of the heart where you see all the valves of the heart. And what I'm trying to say here is, once that muscle layer of the heart is affected, the cells of that muscle layer is now also dying off. Then they will leak into your blood. So when we now do blood tests, you hear sometimes we say that you have high troponin. Your troponin it means that the protein that controls your heart is now broken down because of ischemia and occlusion, and then it leaks into your bloodstream, and that is what we now have, what we call troponin. Okay, the breakdown and leaking of the protein of your heart, we call the cardiomyocyte, into the bloodstream result in high troponin. So now I've explained what myocardial infarction, how it happened, and now I'm going to ask the risk factors. Age is one of the risk factors. So the older you are, sorry, there's a problem here. So the older you are, the more susceptible you are to develop this heart attack. In a simple man language, call it myocardial infarction, and I'm saying the acute because from acute it can now become chronic. Okay, so age is one risk factor. So once you hit age 35, you have to be careful of the things you eat. So all of us, we are in this bracket. So age is one of the risk factors to this heart problem. So the older we are, the more closer we are to having this heart attack, and also the slower our metabolism. So sometimes the things we used to eat, and it's easily broken down when we were younger, by the time you hit 40, 50, things start slowing down gradually. Then the next risk factors to this acute myocardial infarction, which is acute heart attack, is smoking. So if you're a smoker, I'm not judging you, but you have to know, if you love your life and you love your heart, you gotta stop smoking, because smoking is one risk factors that will lead to heart attack. Acute myocardial infarction, smoking is one of them. By the time you keep smoking, you are increasing your risk of developing myocardial infarction. And then hypertension. I've told you about hypertension. I've did a lesson on hypertension. If you don't understand, you need to go back and listen to the hypertension. Hypertension is when your blood is struggling to pump. The pressure at which your blood is pumping and circulating around your heart and even other part of the body becomes so high because of the same arteriosclerosis, which is atheroma blocking your coronary artery. Your blood now struggles to pump higher, and then that is when you now say my blood pressure. The pressure at which your blood flows through the artery is increasing every day, because there are some blockage in your arteries that could result from either blood clots, or it could result from fat, it could result from stress that has damaged your arteries. So it could lead to hypertension. So if you have hypertension already in your history, you're hypertensive, then there's a call for you to take all the necessary precautions that you can to make sure that you take your blood pressure medication, you do exercise, and you eat healthy, so as not to get to this level of myocardial infarction. The next risk factor is positive family history. Positive family history, when you have someone in your family that have heart issue or heart problem. So if there's a history of heart disease running in your family, you stand the highest risk of having the same heart issue. What I'm trying to say is that if someone in your family have had cardiac arrest, which is a heart attack, or myocardial infarction, or they have stroke, or they have hypertension, someone in your family have had that. So that means that you are very, very positive, and you're very close to developing myocardial infarction. So what that means is that you can ask questions around your family if you don't really know about your family, what disease they have, so you can now be able to take a lot of precaution, because those that have positive family history, they have higher risk factors than people without a family history. So it's got something to check about. The next aspect is sedentary lifestyle. Sedentary lifestyle increases your risk of developing myocardial infarction by 70%, according to research. So if you mean sedentary lifestyle is a lifestyle of sitting down all the time, you're not busy, you're not exercising, you're not working, you're not running around, you're not using the stairs, you're always sitting down at home watching television, you know all the series of the program that is running. There's nothing wrong in knowing all the series of the program that is running, and there's nothing wrong. Thank you very much. Lovely. So that's my thing. I always tell you need to eat healthy. I'm talking about myocardial infarction, so you can drink this as well. It's good. This is cucumber, ginger, and lemon. It's really nice. If you want to add honey to it, you can, but I don't want that. So what I'm trying to say to you is that inactivity, sitting down in one place, watching television all the time, not working, is a risk factor to sedentary lifestyle. And if you are working in a supermarket, or you're a secretary, or you're an office worker and you're always sitting down in front of the computer, Sedentary lifestyle is also applicable to that kind of job that you're sitting down all the time in front of the computer and you're not working, or you're working in the supermarket, you're standing up, you're checking people out all the time, you're in one place. Having a break is very good. According to the Health and Safety at Work Act, or Health and Safety Welfare Regulation of 1992 of Great Britain, every now and then you need to take 10 minutes break from where you're standing or sitting down and walk around. Every hour you should take a 10 minutes break. So now another risk factors for myocardial infarction is high cholesterol and triglycerides. High cholesterol, a lot of you know what cholesterol is, and I've said it before. If you're someone that likes to eat a lot of oil in your food, you need to cut it down. A lot of fat, a lot of butter, you need to cut it down, especially when we are getting older. You're in your 40s, you're in your late 30s, you're in your 50s. You need to definitely cut down the amount of fat that you're consuming in your food. And a lot of people cooking with ghee, that ghee is also saturated fat. And I did mention in one of my videos, if you actually needed to cook, you can use sunflower oil, which is plant-based oil, and is high in polyunsaturated fat, and also it has some element of omega as well. So you can use polyunsaturated fat, and make sure that your oil has polyunsaturated fat higher than saturated fat. And also palm oil as well is very high in fat. You can look for alternative to use in cooking, especially for my African sisters. We like to use palm oil a lot, and that also increases our risk of developing myocardial infarction because it builds up cholesterol and triglycerides. And the next one is diabetes. And diabetes is you have a risk of developing so many cardiovascular diseases, and myocardial infarction, heart attack, is one of them. So the best way for you to avoid this happening is for you to take your medication. As a diabetic patient, take your medication regularly, and also do exercise and eat healthy. Get a dietitian to look after your diet, and that will be very helpful. And the next one now is the presentation. A lot of people want to say, okay, she's telling me what is myocardial infarction and risk factors. I want her to tell me, how will I know that I have it? Because I say the video is for you to identify myocardial infarction. So if you identify the symptoms, then you can get help on time. So what are the presentation and the history that patient come into the clinic with? The first, number one, is chest pain. Chest pain, and the first one is chest pain. Sometimes the chest pain is at the center of the chest. You feel this tightness in your chest. Sometimes you say, oh, I am walking on the street and I have this chest pain, and when I sit down the chest pain is gone, and the chest pain lasts for 5 minutes or 2 to 3 minutes, is gone, and you just forget about it. My dear, I have to let you know that when you have those kind of chest pain, that common when you are walking, and that pain is in the center of your chest. Sometimes it's like elephant sitting on top of your chest. Sometimes it's so heavy and so tight, and 1 minute is 2, 3, 4 minutes, 5 minutes is gone. Sometimes the last 5 minutes it just disappear, and for the next 1, 2, 3 weeks you don't feel that pain. Sometimes it can be up to 1 month, 2 months, you don't feel that pain. You just assume that, oh, it was just normal chest pain. Any kind of chest pain you feel, you need to see your doctor. It's very important. That pain that is in your chest. And I've said that the pain is in the center of your chest. Sometimes it's very tight. But I want to let you know that the pain radiates. Sometimes the pain radiates to your right hand. Sometimes it radiates to your back. Sometimes it radiates to your shoulder. Sometimes also it can radiate to your neck. Sometimes it can radiate to your jaw. So when you feel this kind of pain, you should identify that this is a sign of heart attack. I need to see a doctor. I need to get to the clinic as soon as possible. And then after you finish having that sharp chest pain or chest tightness, you can also have what we call shortness of breath. You feel that you're out of breath. Sometimes you notice it in the night when you're sleeping. You find out that you are short of breath, and sometimes like your breathing is ceasing, or sometimes you have to like use so many pillows to sleep, or sometimes you have to jump out of your bed to catch breath, it means that something is going on in your heart. Because remember, heart attack is heart attack is actually I'm talking about, but if it happens, it will also lead to what we call heart failure in the end, which is the end of myocardial infarction if nothing is done about it. So, and sometimes you feel so sweaty as well. Sometimes patient is so sweaty, they feel so sweaty, and also sometimes the patient also feel like nauseous and they feel like they're going to vomit. So what do we do? So when you come to the hospital, we are going to take your history, and you have to tell us when the chest pain started. Are you feeling any shortness of breath, chest pain? Are you feeling nauseous? Is the pain in the center of your chest? Does anything make it better? Some people feel, okay, the pain is good when I'm lying down, is worse when I am walking, or the pain is worse when I'm sitting down, which is a unstable angina. When you are sitting down, you have this chest pain. Any chest pain you have, right, as long as it's not related to the kind of job you do, it's good for you to check things out. Don't take it for granted. So we do what we call cardiovascular examination. So we're going to examine your chest, we're going to examine you, and also listen to your heart. And after we finish that, we need to check your blood pressure. Sometimes your blood pressure might be normal, sometimes it might be raised, because if you have that chest pain, your blood pressure might shoot up as well. And then you might also have temperature, and also you might also have what we call tachycardia, heart rate that is raising very high, because you feel palpitation. So sometimes you might even feel your heart beating. You might feel your heart beating so hard. So that is, if you're lying down in bed and your heart is beating, you're hearing it, you need to speak to a doctor. That is a sign of myocardial infarction. So what will we do if you come to the hospital? So we will also, after the examination and after history examination, so we're going to do blood tests, and we'll do what we call full blood count, Usenis. Also look at Usenis, looking at your electrolytes, look at your liver function test, look at your kidney functions. We also look at the protein that I mentioned earlier. When the protein start leaking into your blood, the heart protein start leaking into your blood, we call troponin, it will rise. So your troponin will rise. Your troponin rises is a sign that something is wrong with your heart, and we have to keep you at the hospital or in the hospital for treatment as well. And we also like to do what we call a CRP. A CRP is to look if there's any creatinine reactive protein, to check if there's any infection as well. If your CRP raises, then we also would like to treat you with antibiotics. So, and also we like to do what we call ECG. ECG also is very important, because the ECG will pick up the ischemia, showing that your heart is deficient of oxygen. And also sometimes we can also have what we call heart block. It could be partial or complete heart block, but majority of the time ECG is going to show ST changes. And sometimes if it is unstable angina, the ECG will not show any change. Alright, so I hope you are understanding me today. So what's the management of it? People that live in Africa, and some of you don't go to hospital, people that live in Britain and other developed country in the Western world, we are very fortunate that we have hospital, we have doctors that are ready to see us, and they know what to give to you. But if you are living in Africa and you don't really have hospital, and you don't know what to do, you're having chest pain, it's going on so long, and I feel sorry for saying that, but I know, because this is the problem that is affecting Africa. So the management of it, I'm just going to tell you the ACS protocol. So we use that for treating anginal and also myocardial infarction, which is part of anginal protocol as well. So aspirin is very important. So aspirin, but please don't listen to this video and start taking aspirin when you don't have a doctor. The doctor needs to monitor that aspirin. So you need to take aspirin, and there's another one we call Clopidogrel, and then we also have GTN spray. So you need to take the GTN spray. Also have morphine. Morphine is very good for that chest pain. So if you take all this combination and we keep monitoring you, if your CRP raised, we treat you with antibiotics and everything will be fine. So, and that is it with the myocardial infarction. If you have any question or you want to ring me, my number is out there. Call me anytime, ask me any question, I'll be ready to answer. In the meantime, I'm just keeping it cool and real here, telling you about myocardial infarction, heart attack, and how to identify it, and what we do in the hospital, and what you can do as well. Whenever you see the chest pain or you feel the chest pain, please go and see a doctor. Thank you very much. So I'm finished with that one. Thank you. Bye. See you sometime next week. Bye.